Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi everybody, Tom Viola with Pharmacology Declassified with yet another Fast Facts Pharmacology Edition. I'm loving this series we're doing on supplements because it seems like we're getting to the bottom of things, right? Like we're finally uncovering the truth about supplements and the things that people use to maintain their health outside of prescription drugs. Well, this next supplement is indeed something that's near and dear to my heart and my stomach, and that's what? Garlic. Look, I know and you know that garlic tastes amazing sauteed in olive oil and spread over a little pasta. But is that the way to lower your blood pressure and lower your cholesterol? Well, we do know that garlic has alkaloids that are both antioxidant and antiplatelet in their activity. And that those alkaloids also inhibit a specific enzyme in our bodies called HMG-CoA reductase. Now, the antioxidant part means that garlic can do lots of things like help with blood pressure and help with vascular issues. The antiplatelet action means it can actually make your platelets less sticky, which would help keep clots at bay. But the fact that it also inhibits HMG-CoA reductase means it actually reduces our production of cholesterol. So you could say that garlic is well on track to treat the things that garlic is touted to treat, which is hypertension, hyperlipidemia, and coronary artery disease. So what's not to love, Viola? Garlic's amazing. Well, here's the thing. You can't cook it, because when you apply heat, you destroy those active ingredients that give garlic its great potential. Still tastes great drizzled over pasta, but it doesn't do anything for you as far as your health. So to get the true health benefits of garlic, you have to eat it raw. Raw? Yes. You know, put the clove between your teeth and chew, or use a garlic press. Well, nothing wrong. That's fine. I like garlic raw. It smells great. It tastes great. Well, that's true. But even though you can use garlic to lower your blood pressure, lower your blood sugar, and lower your cholesterol, you might not have that many people to tell about it if you're eating raw garlic. And remember, it does cause GI upset and flatulence, which again doesn't make you many friends. All right, well, give me the lowdown. What is the effect of garlic on dentistry? Well, we do know that garlic is one of those G herbs, right? Garlic, ginseng, ginger, and ginkgo that cause additive bleeding when they're combined with other drugs that can cause bleeding as well, like antiplatelet agents, Plavix and aspirin, and anticoagulants like Coumadin and Xarelto. But it can also cause additive hypotension, especially if you're using it along with an antihypertensive medication like a diuretic, calcium channel blocker, beta blocker. And it can even cause additive hypoglycemia if it's combined with medications to treat type 2 diabetes mellitus. So that'd be drugs like glyburide, metformin, and even some of the new incretin mimetics, like Januvia would be one drug, and semaglutide or Ozempic would be another. And can't watch TV without seeing 5 commercials for Ozempic and Trulicity, right? So in any event, my friends, it's a great drug to be used, and garlic is a great supplement to be used, but combining them would cause those additive side effects that I'm sure nobody's looking for. So advise your patients if they're using garlic, maybe a great supplement to take. Make sure they take it where they get the full allicin potential, meaning that no heat was applied, and make sure that they know that the combination of garlic with some medications can create side effects or additive effects that may not be very welcome to them. And that, my friends, is yet another episode of Fast Facts Pharmacology Edition. This is Tom Viola, and again, I'm saying, be well. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.